Hello. From the University of Waterloo, I'm Brandon Sweet, one of the hosts of Beyond the Bulletin. Welcome to a special edition of the podcast. In addition to leading the university as president and vice-chancellor, Vivek Goel is a public health physician and researcher who has worked hard to help improve Canada's response to COVID-19. As we face Omicron, the latest variant of concern, he joins my co-host, Pamela Smythe, to discuss the ways it has changed the pandemic, its impact on society, and what to do about it.
Vivek, thank you so much for joining me.
Great to be here.
You are an expert in public health. Before becoming the president and vice-chancellor of the University of Waterloo last year, you supported Canada's response to the pandemic as a member of the Federal COVID-19 Immunity Task Force. You also served as scientific advisor for the CAN COVID Network, which is a national network of researchers in the areas of health, science, and policy, created to promote collaboration on COVID-19 research. We're so lucky to have someone with your expertise leading us at the university during such uncertain times and to provide us with some insights here. Now, COVID continues to dominate the news cycle and our lives. Despite, or maybe because of all of that discussion, there is some confusion. We have increased measures in place to protect the public from the spread of Omicron, but we hear that Omicron isn't as severe or as deadly as previous variants. That said, Ontario's health minister says there's been explosive growth in hospitalization. So can you help us make sense of that? What's the situation?
I think it's important to actually think about the impact of the virus as opposed to the severity of the virus. You know, the impact of the virus on the population is really driven by a number of different factors. And one of them is how fast it goes from one person to the next, how transmissible it is. The second is how bad the disease is in each person that it infects, the virulence of the virus, and what is the degree of protection that each individual has from either getting the disease and or the severity of the disease if they do get it. And that's their prior immunity. And so when we talk about comparing the Omicron to the Delta variant or the Alpha variant before that, or the original wild type variant, which was first detected in Wuhan, you can't just say, is it more severe or not? Because it's comparing all these different characteristics at once. And the evidence is still evolving, right? But what we do know is that the impact of this particular variant, the Omicron variant, is less than the impact of Delta. But that is in large part because of the prior immunity that our population has. And there's some evidence to suggest that the virulence of the virus, the degree of disease that it causes in people that are infected, is also less than that of the Delta variant, the one that just came immediately before. But the amount of that is still being established. There's some people who are saying that the virulence, how severe the disease is in each individual that's infected with no prior immunity, is probably still about the same as the original wild type variant virus. What the Omicron variant clearly has as an advantage is its transmissibility. Each person that it infects is going to infect many more people. And again, the numbers vary, but it's probably about at least 2 to 3 times more than Delta, and 2 to 3 times, Delta was 2 to 3 or more times than Alpha, and Alpha was more than the original. So it's many times more transmissible than the original virus that we saw back in late 2019 and spread around the world in the beginning of 2020, and probably causes about the same severity of disease in each person that it infects. And so if we can think back to the early days when it was first appearing in Italy or New York, and we saw ICUs being overrun, if we had had this virus back then, we would have had total devastation throughout the world, right? Because it was many times more severe, causing the same type of disease. So the reason why we're talking about it having less severity is because since the beginning of 2020, we have started to build up population immunity. And it's built up in two ways. One, people have become infected with the disease, and we've got the vaccines. And so that's allowed people to be protected against infection to a certain degree. But more importantly, it's allowed people to be protected from having really bad consequences if they do get infected. And so what we're seeing with Omicron is the vaccines are less protective against infection with Omicron than they were for Delta and the earlier variants. But they still protect against being hospitalized or needing to go into the ICU and go onto a ventilator, and they protect against death. What's happening right now is we're seeing a very rapid spread of this particular variant because the prior immunity, either from disease or from the vaccines, does not protect to the same degree against the transmission. So we're seeing the cases in vaccinated people, but we're not seeing vaccinated people being hospitalized at the same rate or needing intensive care or having the unfortunate consequence of passing away. So I know it's a long answer, but it's a complicated situation. So that's why we can wind up with this situation where we'll have a headline saying it's not as severe, it's not as deadly, but that's in large part because of this prior immunity that we've built up. But we can also say it's having devastating consequences for us as a society. And that's because of a couple of things. One, because it is spreading as a disease, and even in vaccinated populations, it is spreading to many people all at the same time. Mm-hmm. And so that's got the consequence that we're going to have a lot of absenteeism, either because people have been infected or because they've been exposed and they're asked to go into isolation as a result of that. But the other consequence for the health system is that because it's infecting so many people all at once, and even if they're vaccinated, they are protected against having to be hospitalized, but there's still going to be a certain proportion. And even if that proportion is very small, a fraction of 1%, when you have millions of people infected at the same time, that very small percentage multiplied by that many people at the same time results in a lot of people having to go to hospital. And the final thing I'll just say is we still have 10 to 15% of people that haven't been vaccinated or haven't had their 2 doses. There's a certain fraction of those that are children under 5 for whom we still don't have vaccines approved, and the children 5 to 11 for whom the vaccine was just approved a few months ago, and so they're still in the process of getting vaccinated. So again, Omicron spreading into that population is going to result in a higher rate of hospitalization because even though the disease is milder in children, again, as we start to spread so fast, there's just going to be so many children being infected at the same time. We will start to see hospitalizations rise in that population. And then we have adults who have not been fully vaccinated. And so, unfortunately, what we are seeing in our hospitals right now is the vast majority of people being hospitalized and almost all the people needing to be in intensive care and having to have ventilators are the unvaccinated.
People who have had COVID, they don't have the same immunity as somebody who's double vaccinated, do they?
No, there is immunity from prior disease, but we still do not know enough in general about how the body's immune system works. Sometimes people find it hard to believe, but these are still evolving areas of science. And then when you get to COVID, it's still a relatively new disease. And our understanding, this is the work that the Immunity Task Force that I've been a member of the leadership group for has been funding and supporting in Canada, and there's researchers around the world continuing to look at it. But what we do know is that the degree and duration of immunity will vary depending on the vaccine versus natural disease. And then for natural disease, it depends on the type of infection that you had. Some people had a very severe infection. Some people have a mild asymptomatic infection. And for the vaccines, we also know that it is ultimately going to probably vary depending on which vaccine you had, the interval for the doses, and now as we get into booster, whether you've had a booster or so on. Vaccines were always about keeping people from having to be hospitalized, from suffering death. It was a bonus. The vaccines protected such a high level of protection against infection. The 90% that we saw early on with the mRNA vaccines against infection from the earlier variants. When the WHO first set its standards for the vaccines, it was saying that a 50% level of protection would be an acceptable vaccine. So we kind of, over the last year, we got spoiled by that very high level of protection that we got from these mRNA vaccines right off the bat.
What are the implications of looking to other parts of the world when we're looking for clues about ways that a certain variant will affect our Canadian population?
We always want to learn from every bit of information possible from around the world, but we have to look at that information with the right lens and the right context. We have to take account of the differences in the age distribution of the population because we know that the elderly are more severely affected. We have to take into consideration the differences in the public health and health systems, the capacity for surveillance, the capacity to follow up on people and to treat people. And so with Omicron, a lot of early attention on South Africa, where it was, really kudos to the health system and public health agencies in South Africa. They identified it quickly. They reported it to the world. But it's a very different setting. The levels of vaccination were much lower in the state that it was first detected. Right away, you can't compare. Another very significant difference in South Africa is they had a very high wave about a year ago of the beta variant, which we never really saw in North America or Europe. Perhaps the beta variant prior infection provided a greater degree of protection against Omicron than Alpha and Delta do. This is the kind of research that's now being done. Like, if you had exposure to these earlier variants, did this protect you? And also in the future, we'll want to know, does Omicron protect against those variants or other variants? And so that's why when we're looking at this evidence as it's coming from around the world, we can't just jump at the first headline. It's worse, it's better, because we have to understand what that underlying context is in that particular region. And the same actually applies across Canada. The COVID experience in Nova Scotia is different from the COVID experience in Saskatchewan. Every jurisdiction with Canada has had different experiences between different waves of the virus. And the same looking at the vaccinations, all of the vaccines that we've been using in Canada are very good and very robust. But we do know that the immune response for AstraZeneca is different from the immune response for the mRNA vaccines like Pfizer and Moderna. Countries, so like when we're looking at the UK, they had much higher rates of AstraZeneca as their earliest vaccines. Their experience is going to be different from countries that had more use of mRNA vaccines. The other thing is when we're talking about things like how long after vaccination people are starting to get disease, countries that vaccinated their most vulnerable populations first, which makes absolute sense from a moral and ethical perspective, are going to see more waning immunity sooner because those are the populations that will have the most waiting. If you're
Okay.
older, your immune response will come down faster.
Okay.
So we can't necessarily draw a conclusion from that experience to the entire population either. There's been different strategic responses, different policy responses. And in the UK, they lifted pretty well all restrictions in the summer, even though they still had very high levels of the Delta variant. And all through the fall, they just lived with those higher levels. And so that's also why when Omicron hit, it hit them fast because they were already with that. And when they started to announce restrictions late in 2021, because they're saying, okay, we're going to require certification of vaccine to go to restaurants and bars, or we're going to require masks on the public transit, they were actually imposing the restrictions that we already had in place.
Well, what does the Omicron wave look like for us, and why?
In the earlier waves, we were much more focused on what the impact is going to be for our healthcare system and particularly for our intensive care units. And
Right.
we were worried about running out of that capacity. We still have a concern about that just because of the sheer numbers. But at this point in time, the concern in the healthcare system is actually just simply the hospitalizations, because in the vaccinated individuals who do need to be hospitalized, the vast majority, they don't need to be in the ICU, but some of them are being admitted. They need to be in for a few days to get stabilized. They're able to go home, but there's a constant churn. So it's a different kind of impact for the healthcare system. And, when someone's admitted with an infectious disease like COVID, there's extra precautions. The rooms have to be cleaned. If that person with the hip fracture is diagnosed on admission as also having COVID, it may not be severe enough that it's causing symptoms for them. It puts an additional burden on the hospital. They now have to take the infectious disease control protocols for that patient, additional masking, gowning, additional cleaning requirements. Further magnifying the impact for the healthcare system is because the disease is spreading so fast, we have these high levels of absenteeism because so many healthcare workers are being exposed. So many of them are being asked to go into isolation. We have that layered on to burnout after 2 years. And then finally, from a societal perspective, these same levels of absenteeism we're going to see across, and we are seeing across all sectors of society. And, one of the reasons schools went to remote learning, why we've gone to remote learning, there's certainly a safety aspect, there's reducing the number of transmissions that are going to happen in the community. But from a logistic perspective, what we have to be prepared for is if we do get to 20 to 30% of people being absent at the same time, it turns into a logistical nightmare, whether we're trying to run the university, trying to run schools, a police service, or a transit service.
Right. Well, let's talk about the things that people can do. Are people keeping up with the vaccinations? Are they getting their kids vaccinated?
First of all, for the children 5 to 11, the rate at which they're getting vaccinated has really slowed down. We're at about, I think, 45% across the province with first doses. So there's still a long way to go. And so I know there may be people who, and the same will apply for adults with boosters, people may have gone in a few weeks ago trying to book appointments, and they've got appointments in February or even in March. I would really encourage them to go back and look again, because following the holidays, a lot more clinics have been added in, and there are spaces. We also know that some people book multiple appointments and then they take the first one they get, and they don't always go back and cancel those. And so what I'm hearing from many of the people running the clinics is that they have a lot of no-shows. That just means someone else is not able to get their vaccination.
That is terrible. Don't do that, people listening.
That's the same for the boosters, right? So because we saw those pictures before the holiday break, the Hunger Games, the lineups, and so on. But I heard yesterday that some of the clinics have literally hundreds of vacant appointments a day.
I heard people were turning down the Moderna booster. What do you want to say about that?
From a biological perspective, the Moderna and the Pfizer vaccines are almost identical. And there's really no reason in the best of times that you should be choosing. In these times where we're facing this incredible wave of Omicron, you should just take the first vaccine that's made available to you.
Now, what about masks?
So for the average adult who's not working in a specific healthcare setting, like doing respiratory procedures, or in our environment, in a clinical setting, there might be some research settings, having a good medical grade mask, and we've just put out some new information on our COVID site about this, or a 3-layer cloth mask with a filter barrier, and the University of Waterloo branded masks have that standard, and you can order the filter layers. If it's well-fitting and used properly in those vast majority of settings that we're going to find ourselves in, is going to provide the degree of protection that we need. What we shouldn't be using at this stage is single-layer cloth masks, bandanas, and gaiters.
Right.
Unfortunately, you can go into stores or online. There's a lot of paper masks that don't have those medical grade 3-layer protection, or masks that don't fit properly.
In your expert opinion, when and how can we get this to end?
So I guess there's two parts of that. One is when are we going to get through this wave with Omicron? Mm-hmm. And because it is so transmissible, it is going to move through our population really fast. The protective measures that we're taking are going to blunt the peak of the curve, so it will go out for maybe a few more weeks, but that's necessary to keep our healthcare system and our societal infrastructure from getting overwhelmed with everyone being infected at the same time. Mm-hmm. So, I would say another 3 or 4 weeks, we should start to see us passing the peak, and then it'll take a few more weeks after that. Mm. Certainly by sometime towards the end of February, I think we will be seeing the back end of this.
Okay.
The second part of your question, though, which I think is what you were really getting at, is when is this all behind us?
Yes.
And that's a complex question because particularly with what we're seeing with Omicron now, it's pretty clear that we're not going to have, from vaccination, a high degree of protection against transmission, that's durable. And so the virus will continue to circulate. We know, and I'm sure we'll continue to work on this, that we will have protection against having to be hospitalized and so on. So it starts to look like flu and other respiratory viruses. And so at some point, we have to have a societal discussion around, we're done with this, we're moving on. If you look at some parts of the United States, they've just said, we're going to accept this, we're going to accept consequences, consequences that we as a society are not prepared to accept, right? At some point, we have to have a discussion because there will always be cases, there will always be infections happening, and we're going to have to decide what that acceptable level is. I certainly absolutely believe in vaccine equity, and we have to get much more vaccines out, but we're also going to have huge challenges with getting everyone vaccinated. So that's going to mean the virus will continue to circulate. Mm. If we were to miraculously get to 90% of the entire world's population vaccinated, it's not going to protect us completely from this virus. I wish I could remember where I read this, but someone very early on actually wrote, COVID-19 pandemic will end when we say it ends.
What other points would you like to make before we close?
Make sure you continue to follow those public health precautions. Mm-hmm. Over these next few weeks, we do need to hunker down and limit our daily contacts so that we reduce the amount of transmission, so that we don't overwhelm further our healthcare system, that we're able to maintain our essential services. And everyone needs to do their part, wearing appropriate masks, staying home if they're symptomatic or told if they're going to their isolation, and getting whatever dose of vaccination they are eligible for as soon as they can.
Good advice. Well, thank you so much for being with me, Vivek, and also all the work that you're doing to do with COVID-19 for the whole country.
Great. Well, thank you very much. Appreciate it.
Well, that's it for this special episode of Beyond the Bulletin with Waterloo's President and Vice-Chancellor Vivek Goel. You can find all of our past shows on SoundCloud.com. To ensure you don't miss an episode, please subscribe to the Beyond the Bulletin podcast wherever you get your podcasts. You can reach us at bulletin@uwaterloo.ca. From my co-host Pamela Smythe and me, stay safe, everyone, and thanks for going Beyond the Bulletin.